Blue Boost. Hello, can you hear me? So, thanks so much for being with us. So we have a very tricky case right today. It's a patient with achalasia. So it's a type 2 achalasia, but with very sigmoid esophagus. So I want to try today to show a new technology. Abre. Inyecta. Momento. Sigue. Momento. Inyecta. So I'm injecting Blue Boost is hyaluronic acid, but there is a lot of inflammation, huh? Lot of inflammation, huh? Lot. So, retira. I think this is a difficult case. Abre. Inyecta. Sigue. Sigue. So I am trying to inject very well to see which are the areas that allow us to go inside. Sigue inyectando. You can see now. So I am using Blue Boost from Microtech. I like it, this product. Inyecta. Because it helped me, at least in this kind of cases. Inyecta. You can see. Okay, para. Retira. So now I will try to go here in this area. Abre. Sigue. Very good. Now I have a good submucosal sigue. Para, retira. Very nice. Okay, now I will continue here. Why I am doing that? Because I will work now with the microwave technology. Thank you to Creo Medical for support us. I want to say thank you to my good friend Peter Mendiola and David Woods, Greg Calder. Thank you for supporting us. Also, Chris Lee, thank you for supporting us as always. Okay, dale. So, dale despacio, yo te voy avisando. Sigue. Sigue, para, retira. So I am injecting, I am going in the way that I need to go, because the problem of this tunnel is the sigmoid esophagus that the patient have, which make very difficult to make our surgery. Abre, inyecta, sigue, para, retira. So why I am using hyaluronic acid in this case? Because I want to go until the sphincter in a good way, without having, because we can, in this tortuous esophagus, is very difficult. Abre, inyecta, and it's very difficult sometimes to achieve correctly. We can be lost in some cases. That's why I am putting this first. Saca, retira. and I'm trying to be sure that I will reach in a correct way my sphincter, right? And not losing my time. Abre. Inyecta. Sigue. Para, retira. Okay. So let's see how it's going on here. So this is my sphincter now. And I will put my last injection here. Okay, okay, abre. Inyecta. Sigue, sigue, sigue. Todo, 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 todo. Okay, finish. So now I do very well my big vessels. This is very important, huh? Okay, I will use the ultra slim speedboat from Creo Medical. Ponlo ahí en la pantalla. So one of the big advantage is that this use microwave technology and also bipolar energy to make or surgery. This is the new processor, very good. Gira, 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 gira. So we can you see, we can change the position, and now I will go. So now we start to cut. Gíralo, ahí. Now I am doing coagulation with microwave technology. And now I am cutting. You see? I will make a short poem. The results of the last meta-analysis showed good results, but I believe in these cases it's most interesting and most important. You know why? Because so now ahí está, ahí está. Cuidado. So now I am dissecting the submucosal. It's very important. I need to see if I can get the tunnel. Not yet. I need to dissect a little bit more the submucosal. This is very important, right? So we see a big vessel now. And now I am trying to make a coagulation here. Very good. Puede girar. Momento. Puede subir la coagulación. Sí, pero puede subir la coagulación. Ahí, súbela. Sigue, sigue. Ok, listo. Ok. So when you are applying microwave coagulation, it is very important. No, no, no está. Ya, listo. No, no, no. 30. Listo. Listo, listo. Chao. Tienes que salir de ahí. Ya. You see, I am having the coagulation now. You see? So I make a good coagulation, I believe, because I saw the vessel there. Now I am trying to get coagulation a little bit more. And now you see, I try to use the water of my, water jet channel from the scope because I need to have a good position now. I'm almost inside the tunnel, and this is the best part and the difficult part. You can see there is still some, fibrotic tissue because of. I'm doing a big coagulation because I see a big vessel here. Trying to. You see? One of the big advantage is that you see I make the coagulation now. I am inside the tunnel, I believe. I need to push a little bit more to be completely inside. You see? But límpialo. I need to clean a little bit because I cannot see very well. but I am almost there. So you can see the vessels very well. I am in the submucosal area. Yeah? Yeah? Okay, done. Gíralo. Gíralo así. Lo amarillo hacia arriba. Okay, now I am fine. Very well. Gíralo un poquito así. Perfect. Okay. Not an easy tunnel, but we achieve it. I cut a little bit the muscle, but it's not, you know, it's something that we cannot be worried, because we need to retake our tunnel from the submucosal layer, and the most important is to get very well or very clear or submucosa is up. You know, the problem is that there is a lot of inflammation, which make it a little bit difficult. But now I am getting a little bit up. So now I am trying to get just the submucosal opening. Now I am doing a coagulation. You can see very well just with the microwave, so I can diminish the risk of bleeding. But this patient is a little tricky, huh? No easy, huh? No, it's not an easy case, huh? Now I'm doing a coagulation of that vessel. Let me see. Very well. And now I am getting much better. My position, trying to get in. Now I am inside the tunnel, right? I believe. No. No, no estoy en el túnel. Juan Manuel dice que no estoy en el túnel, ¿ah? Yo creo que sí, ¿ah? So Juan Manuel said that I am not inside the tunnel. I believe I am. So it's okay, ¿ah? Let me make a coagulation of this vessel. Very good. You see, the vessel is becoming white. It means I did a very good coagulation in this area. So now I am cutting. and now I have to take care about this big vessel. So now I am doing a big coagulation here, just with the microwave technology. You can see it's good, but it's not perfect. So I need to do a better, you know. So I recovered the tunnel. Now I am trying to inject. You see, there is a lot of fibrotic tissue, but I believe we can deal with it. I like the bipolar cutting because of I am doing a coagulation now. So you see the vessel is there. I do the coagulation, but there is still need of continue doing a second coagulation. You see, I will use the microwave. Okay, now it's fine. Very good. I need to make a coagulation here. You see very well the coagulation with the microwave. Perfect. So I am doing the coagulation because I need to be clear regarding what I am doing. So with the new microwave, you see, with this ultra slim speedboat, I can inject, which is really nice and help me a lot with my procedure. You see, now I need to make a coagulation again here. Now I am injecting, and now I am pushing. There is a lot of inflammation, that's why we see a lot of vessels, and I need to make a lot of coagulation. Now. You see, I like to inject a lot. Now I will try to go from the up part, not from the down part, because I am very near to the muscle layer. I want to dissect, really make a good dissection of the submucosal tunnel. Now I am doing. I want to see very well my vessels. I want to see if I am in a good position. I think we are in a good position, but remember that this esophagus is like a sigmoid esophagus, which make a little bit tricky the procedure. Not impossible, but tricky. So I need to dissect here. I am doing my dissection with the bipolar energy, and I am doing the coagulation with the microwave, okay? This is how it works, right? I think the tunnel is doing well. Huh? I don't know if Professor Alcivar what he said. Oh. Now I am doing microwave just to make a coagulation of these vessels. You can see very well here. This is submucosal. You can see it's a lot of inflammation. Huh? Now I will make a coagulation of this vessel. I don't want too much bleeding because if not I cannot see very well. So now I make a good coagulation. Now I am doing a good dissection, you can see. So now I am doing my space very well. This is very important. To have a good space, the third space needs to be very well done. There is another vessel, you can see there. So I make a coagulation here. Let's see if it makes the good coagulation. Okay, perfect. I will do again because I believe it needs a little bit more. Perfect. So now I will cut a little bit. You see? Very slowly because there is a lot of vessels, a lot of inflammation. Now I will do a coagulation here in this area. Again, you see? Very well. Now I will cut. You see? Very well. Again, you see? Even if I am doing a prophylactic coagulation, it's difficult because it's a lot of vessels in this case. But well, I believe we are doing a good advance here. It's a lot of vessels, huh? Now I'm injecting. We are almost near to the cardia now. So now I will cut. I need to cut here. Opa! There's a big storm here, huh? I think heaven is trying to say something to us, huh? I am cutting, cutting, because this is important. I need a space. So I will inject blue. You can see very well now with my slim, ultra slim boat. Okay. Now you can see the muscle how it goes up now because it's a sigmoid. You know, it's a sigmoid esophagus, which make very difficult. Now, very good. I will cut. Now I am making some coagulations. I like to make some prophylactic coagulations in sometimes because it makes you do easier. So now we are cutting. Now I need to cut up. I am trying to get a good position, huh? Ok, gíralo así. Ahí. So you can change the position, and that way you can cut much better the submucosa layer. Now I want to cut here. Very well. Sometimes the position is not easy, but it will depend how it will present to you during the procedure, right? So, well, tenlo recto. Now, for example, I think it's much better to go from so you see there is a big vessel there. So what I want to do now is to make a good coagulation over this vessel. Can see? Okay. I think I do it. And now I can cut. Vessel. Let's do some blood coagulation here. Vessel coagulation. ¿Qué pasa? ¿Cómo? No. So there is a question from the audience. Who is? Carlos Donés. He have a problem. He's how we say that a conflict of interest. He's from Creo. He's asking me if the power of this technology can diminish, right? The pain, right? Post-procedure pain. To be honest, Carlos Donay, I didn't have too much patience with pain. Less than 3% in the whole series. It means the biggest series from United States and the second biggest series from us. The pain is something that can happen, yes, sometimes, but it doesn't. I believe it doesn't depend on the on the device, on the energy or whatever, to be honest. So until now there is not evidence in terms of literature about this concern. There is a study, I believe there is a, this was abstract published in DDW saying that the posterior approach have more pain than anterior approach, which I never saw it because I always do the posterior approach, just in exceptional cases, right? So I'm not so sure about that. Okay, and after that I didn't saw any other report. So maybe we need a trial to do that, to evaluate that. But at the moment I cannot say that this is because of the energy or it's because of the position or the way that we are doing, right? So I'm trying to advance, but it's a little bit tricky to advance here. Huh? So I want to see where I am. I believe I am here. As I mentioned to you, it's difficult because of the sigmoid esophagus that we have. It's very tricky, but it's not impossible. Huh? Here, here. Espérate un segundo. I am doing a microwave coagulation now. Necesito una coag rasper. So I will change. I will use a coag rasper now. It's a lot of big vessels, which make me very difficult. So I will remove a little bit. I want to see my tunnel. And I want to see where I am. Okay, now I am out. I am out. So I didn't achieve here. Where we are. Oh my god. So here is my tunnel. And here's where we are. Okay, so this is my tunnel. Again. Muéstrame la cuchilla. La cuchilla. I need to get inside the tunnel again. Let's Let's make a coagulation of this vessel. Big vessel, you see? Okay, let's see how microwave works here. Small bleeding, still small bleeding. Okay, now it's perfect. Okay. Let's make a coagulation here. No hay agua ya aquí. ¿O sí? Ok, sí, perfecto. Ok, ok. Puedes girarlo, así. You see, I am dissecting. Gira así. Ahí está bien. Están ahí. Gira. Very tight. I need to cut more here. Microwave now. Now I am doing a coagulation. You can see. I'm in the cardia now. That's why. So the problem is, it's very tight because I am passing the cardia now. So which make very difficult. But we have some tips for this, right? First, I will cut here. Okay, now I open, you see? Very well. And now I will try to cut a little bit more here. So my problem is here. I need to... Gíralo, así. And sometimes when you don't have too much space, sometimes we need to cut the muscle, okay? Because it will give you a better space. But I will try to see if I can cut a little bit more of the submucosal. This is like a kind of gel. There is not less in us to advance. Now I advance, right? That's why you see there is a lot of how to explain to you. It's gíralo así hacia abajo. No, no, así de ladito. Gira. Ahí, no, ahí está. Now I am cutting because I need more space. Now I pass, you see? Now that I pass, I need to understand very well where is my tunnel. ¿Cómo? So now, yeah, up is mucosal, here is submucosal, here. You can see very well, maybe we have a hole up, we will close after. I need to detach this very well. Gíralo. Fibrotic area here, right? What I will try to do is cut here. Ponlo así, mira. Eso. Are not so bad. Very sick. Very sick. I will make a coagulation here. Sin povidina, hijo, sin povidina. No necesitas povidina. Now I am better. But I need more space, you see? Now I have more space. And now we see the vessel from the gastric, you know, the stomach. I believe I will change. I will use the quagrasper now because this is a big vessel. So you can see we are in the stomach. This is the cardia. This is the cardia. So we are almost finished. I'm sorry, it takes a lot of time, but there's a big inflammation in this patient. Abre. Bueno, ahí quédate. El pedal. Abre. Ok, cierra. Abre. Cierra. Abre. Espacio. Okay. Now we are fine. I want just to take here. Abre. Okay. Cierra ahí. Ok. Abre. 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 Ok, cierra. Abre. Okay. Okay. And there is another big vessel there. You can see there. So this needs to be cracked before I continue. Abre. Cierra. Okay. Now I will continue with my procedure. We're almost finished. Gíralo. Así lo quiero. Ok, ahí. You see, I am making a coagulation. Small vessels is easier to make a coagulation, but the problem is with big vessels. So probably in the next future we can achieve to do it with the big vessels, right? Now I need to cut here. Okay, I will change my position now. Now I am in the stomach. I need to make a coagulation here. So when you have vessels from the mucosa, I think this is microwave technology is very good because it can avoid the damage of the mucosa. But well, it's a little bit hard. Ponlo así. Ahí. Now I do it a coagulation. Now I will inject. And now I will cut. I will try to make a coagulation here. You can see the coagulation very well. Yes, but you see, I did the coagulation, but sometimes it's difficult because it doesn't go deeper. Huh? It's an advantage and could be a disadvantage also. Now I'm doing a coagulation again. You see? I'm doing coagulation, prophylactic coagulation. Again. So there is a vessel there, you see? So the problem is that now we are in the stomach, and because of this, you see, here, I believe, let me see now. Now it's okay. Okay, perfect. Gíralo un poquito así. Así. So I am changing the position now. You see very well the dissection. Okay, now I am going to the other side. You see very well. It's very important that you have the control of whatever you are doing. That is very important. Now I will inject. I want more space. Ponlo recto. So I need to change. Very well. Now we have a very good tunnel. Préndelo y vuelvo a apagar. No le saques el catéter. You see the section very well. Very clear now. I am avoiding the vessels. Very well. I think we need the quartz for that vessel. It's a big vessel, so microwave will not help us with that. Abre. Cierra. You see? Okay, abre. Cierra. And there is another vessel that I need to make a coagulation. Abre. Cierra. Ok, listo. Abre. Cierra. Ya. Very good. Almost done. I just need to dissect a little bit to be sure, and then I will cut the muscle. Okay, Milena? Milena is cleaning. Gíralo. Estamos mal. So this is very important to have a good direction of your device, right? No, desconéctalo y vuelve a conectar. Necesito otra cuchilla de estas. Gíralo. I think there is a problem with this probe. I will change the probe now. So, gíralo. Okay. You see, now it's cutting. Oh, big vessel. Dame el coagrasper. I didn't see it, huh? There is a vessel, you see? Abre. Cierra. So I know that I have it because now I am not putting water and I see that the vessel is not bleeding. So I am in the right place now, you see? Perfect. This is very important. Abre. Okay, perfect. Cierra. Let's see again. Okay, I will dissect here. Maybe I will have more access and better access to the bleeding area. The artery is there. You see, is an artery coming from the stomach. So this was a very difficult case today. Okay, so now, gíralo. I will cut. Okay, I will dissect here a little bit. Because I need a space. I'm doing coagulation now. Because I saw a vessel there. And now I am cutting. You see? I make an injection. And now I will cut. I think my vessel is not completely coagulated, huh? So I need esta me la puedo grasper. Sometimes we need to dissect because some vessels are very deeper. Very deep. You see, like this one. In spite that I do a coagulation, there is still bleeding. And we need to be sure that there is not any bleeding, because if not, you will make a big hematoma. So this is very important. Now I am opening. Abre. Cierra. Ok, abre. Now it's fine, huh? I think. Let's see if we put more water. Cierra despacio. I think a little bit more. It's very tricky sometimes to get the position, but it's not impossible, huh? Wait. Así. Perfect. A small vessel here. We make a coagulation now. Okay. Now, we will finish. I need to cut this part, and that's all. Okay, gíralo. And now I will cut here. This is the vessel that was bleeding. Now it's open, you see? Now I will make a coagulation in this mucosa, because in spite that I used the other one, maybe, you see? Microwave coagulation. But the only thing that I have with this is that it goes very superficial, to my opinion. But well, probably we will see much better in the next future. You see? Very well. Mhm. Another vessel. Oh my god. Incredible, huh? Too much bleeding. Préstame la coagulación. Too much bleeding today. I don't like. And see, it's deeper vessels coming from really deep part. And I don't see it. Abre. Cierra. Abre. Cierra. Not ready, you see? Deep vessel. I think we are fine. Wait, espérate, no te desconectes. Déjame. Abre. Cierra. Ok. Ah, necesito que lo gires. Ahí está bien. So now I will inject. Okay. Very nice. Another vessel. I told you that there is a lot of vessels today, huh? Dame el choreographer. Very difficult case. Oh, we are almost finished. I believe we are done here. I will just... Abre. Cierra. Okay. Abre. Abre. Cierra. Okay. So now, let's see where we are. I think we are perfect now. And now I will start to cut here. So we will start the myotomy now. A little bit more up here maybe. Little difficult case, huh? Okay. Ahí. Now it's perfect. You see, I can go deeper, huh? Very well. We'll make a prophylactic coagulation that I like it to do it. I will try to avoid this vessel. I will do a coagulation. Okay, now I avoid that vessel. You see, a lot of big vessels, huh? Try always to avoid it. Now I'm doing coagulation. Perfect. Very nice. What I always do is to perform a coagulation down because there is a lot of vessel coming from down, you see? And sometimes we don't see it, huh? I tried to make a prophylaxis a lot. But this case there was an inflammation from the esophagus because of the achalasia that has been not well treated. And well, it happens, right? No le aplaste la barriga. Ahorita no. No es que no me dejas generar el túnel. So my anesthesiologist is trying to help us. Removing the air from the... Well, this is peritoneum for sure. Now I'm sure that I cut from the esophagus to the peritoneum. Very good. Maybe just here. Very good. It's here. Perfect. So now I finish. Let's see if there is any bleeding, and complete my tunnel. Maybe here. Some. I think we are okay. Let's see. Okay, there's no bleeding. Dame el. So we are done. Now we need to close. I'm doing a flush. I see again. There is no bleeding. Okay, this is very important. Huh? I put also gentamicin. I believe it helps in something. This is not proved. And now we need to close. I need to just to see if there is any open here. I believe we need to close a little bit more. You see, it's open, completely open now. Okay. I went complete deeper. You see, I pass the cardias. But now I need to see. I think I do because of damage, but I need to really see if it is okay or not. It's here, I believe. Okay, no damage here. Here is the damage. Okay, so just before the cardia, here, you see? Okay, I will need some clips. See, déjame ver. I will need some clips here. So this is very important. You see, I saw it when I was doing my... De 11 está bien. When I was doing my tunnel, because in one time when I was there, I was completely lost. So I take the the right path, you know, just be coming back because I was not advancing, right? But now I believe he will be fine, huh? Okay, abre. Abre. Está bien, tranquilo. Momento. Cierra. Ok. Abre. Abre bien. Todo. Ok, cierra despacio. Cierra completo. Listo. ¿Cómo? No, dame uno de 16. So now I will use one of 16 millimeter. Ok, abre. Cuidado, ahorita no. ¿Cómo vas a abrir ahí si yo no estoy bien posicionado? Ok, abre ahí. Abre todo. Ok, abre. Abre todo. Ahora sí lo tienes. Ahora sí lo tienes. Cierra despacio. Cierra todo. Now I'm sure that I do it. A good closure. Abre. 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 Abre todo. Cierra. Ten ahí. Cierra. I think we close, huh? So now I will put water. Water will show me a little bit better if I close correctly or not. Now I will pass. I will try to see here. You can see it's close there. It's close here. Okay, perfect. Now I need to close here. 1.16, por favor. Abre. Cierra. Cierra todo. So now I am closing my tunnel and I believe we finish. Abre. Abre. Cierra. Cierra todo. It's closing very well. See? It's good. Abre. No, gira. Eso. Cierra despacio. Cierra todo. One more clip. Abre. Abre todo. Cierra. Okay, let me see. I think we are fine. Perfect, cierra. We finish. Okay. So thank you so much. I'm sorry for the delay, but it was a difficult case. I believe was good to show it. How we can deal with this kind of cases when the esophagus is very sigmoid, no, very dilated. So it's easier to have well, no so easy, right? There was a lot of inflammation in this patient also, so it was very important to take the good decision to see where is the cushion, really cushion, fluid cushion, do it to have your space to work. It was at 5 o'clock more or less, between 5 and 5.5. Now I have to make a good aspiration before the patient, recovery, because we don't want any kind of, well, I need to make more aspiration, please. Más aspiración, por favor. There's a big clot here. I need to remove it. And we finish. Thank you so much again for staying with us. So I hope to see you soon. Contamos la